If your postmenopausal discomforts persist, the solution might be related to which side of your pillow you're on. Sleep researchers have discovered that sleeping on your left side improves lymphatic drainage, supports hormonal balance, and ensures optimal functioning of digestive enzymes. How you position your body during those precious hours of sleep isn't just about comfort. It could be fundamentally affecting your health, particularly after menopause. Many women struggle with persistent digestive issues, hormonal fluctuations, and sleep disturbances long after their menstrual cycles have ended, often resorting to supplements, medications, or simply accepting these challenges as inevitable aspects of aging. But what if something as simple as changing your sleep position could help address these issues naturally? What if the ancient wisdom that has guided Eastern healing traditions for centuries actually contains profound physiological truths that modern science is only now beginning to understand? The positioning of our internal organs isn't symmetrical. Your anatomy is arranged in specific ways that can be either supported or hindered by your sleeping position. This anatomical reality becomes increasingly important as we age and our bodies require more support to maintain optimal function. For postmenopausal women in particular, the left-side sleeping position appears to offer remarkable benefits for both digestive health and hormonal balance, two systems that often become increasingly problematic after menopause. The reason lies in a fascinating intersection of anatomy, physiology, and the body's natural detoxification processes. I'm Dr. Rachel Thompson, and for over 25 years, I've specialized in women's health during and after menopause. I've observed how seemingly small changes in sleep habits can sometimes have profound effects on persistent health challenges. Today, I'm going to explain why left-side sleeping may be particularly beneficial for postmenopausal women, how it affects your digestive and hormonal systems, and simple techniques to help you comfortably adapt to this sleep position. Before we dive into the details, I'd like to invite you to subscribe to our channel and hit the notification bell. Each week, we share evidence-based natural approaches for women's health challenges, particularly those affecting women in their postmenopausal years. And if you're experiencing digestive or hormonal challenges after menopause, type balance in the comments below. I read every comment and want to understand your specific situation. Let's start by exploring how left-side sleeping affects your digestive system, a common source of discomfort for many postmenopausal women. After menopause, many women notice changes in their digestive function, increased bloating, irregular bowel movements, reflux, and general digestive discomfort. These issues often seem to appear or worsen despite no significant changes in diet. The explanation lies partly in how estrogen affects the digestive tract. Estrogen receptors are located throughout your gastrointestinal system, and declining estrogen levels can alter gut motility, enzyme production, and the composition of your gut microbiome. But your sleeping position can either exacerbate these challenges or help mitigate them. When you sleep on your left side, you're working with gravity to support your digestive anatomy. Your stomach naturally sits to the left side of your abdomen, with its outlet pointing toward the right. By sleeping on your left side, you position your stomach below its outlet to the small intestine, which uses gravity to facilitate efficient emptying and reduces the risk of reflux. Research from the journal Gastroenterology suggests that this position can significantly reduce nighttime acid reflux episodes compared to sleeping on the right side or back. This is particularly important for postmenopausal women, as declining estrogen can weaken the lower esophageal sphincter, making reflux more common. But the benefits extend beyond just preventing reflux. Your pancreas, which produces important digestive enzymes, also extends toward the left side of your abdomen. Left-side sleeping may support optimal drainage of pancreatic enzymes into the digestive tract, potentially improving overall digestive efficiency. Margaret, a 67-year-old patient who had struggled with persistent bloating and indigestion since menopause, found remarkable relief after adopting left-side sleeping. "I tried so many supplements and dietary changes with minimal improvement," she told me. "But after just 2 weeks of consciously sleeping on my left side, the difference was noticeable. The morning bloating I'd come to accept as normal had diminished significantly." What Margaret experienced aligns with what some research suggests. When we support our natural anatomy through proper positioning, digestive function often improves without additional interventions. But the benefits of left-side sleeping extend well beyond digestion. Perhaps even more important for postmenopausal women is how this sleep position affects your lymphatic system, the body's primary detoxification pathway, and a crucial component of immune function. Your lymphatic system lacks its own pump, unlike the cardiovascular system with the heart, meaning it relies heavily on muscle movement, breathing, and gravity to move lymph fluid effectively. The main lymphatic vessel, the thoracic duct, is located on the left side of the body. When you sleep on your left side, you may facilitate more efficient drainage of lymph fluid from throughout the body toward the heart, where it ultimately rejoins the bloodstream. This improved lymphatic flow can have significant implications for hormone balance after menopause. Here's why. Your lymphatic system plays a crucial role in removing excess hormones and hormone metabolites from body tissues. After menopause, even though overall hormone production decreases, many women experience issues with hormone metabolism and clearance. Improved lymphatic flow may help ensure that hormone metabolites don't accumulate in tissues, potentially reducing symptoms like breast tenderness, fluid retention, and mood fluctuations that many women continue to experience post-menopause. Research published in the Journal of Clinical Endocrinology and Metabolism suggests that efficient lymphatic function may be particularly important after menopause, as it helps maintain the delicate balance between remaining hormone levels. The study found that women with more efficient lymphatic clearance reported fewer persistent menopausal symptoms overall. Elizabeth, a 71-year-old who had continued to experience hormone-related symptoms well past menopause, noticed significant changes after adopting left-side sleeping. The hot flashes I was still having occasionally diminished within a month, she reported, and the breast tenderness that had plagued me for years improved dramatically. I hadn't realized how a simple change in sleep position could affect these symptoms. Beyond digestive and lymphatic benefits, left-side sleeping may also support cardiovascular health, another key concern for postmenopausal women. With the decline in estrogen's protective effects on the cardiovascular system, women's risk of heart disease increases significantly after menopause. When you sleep on your left side, you reduce pressure on the vena cava, the large vein that carries deoxygenated blood back to your heart. This may improve overall circulation and reduce strain on the heart. Some cardiologists suggest that left-side sleeping promotes better blood flow throughout the body, potentially supporting tissue oxygenation and nutrient delivery. Dr. Hiroshi Nakamura, a sleep researcher specializing in position-dependent physiological effects, explains, the cardiovascular benefits of left-side sleeping are particularly relevant for postmenopausal women. As estrogen declines, the cardiovascular system needs all the support it can get, and optimal sleeping position represents a simple but potentially significant intervention. Additionally, some research suggests that left-side sleeping may improve central nervous system waste clearance through what's called the glymphatic system. This brain detoxification pathway becomes increasingly important as we age, potentially affecting cognitive function and mood stability, both common concerns after menopause. A study published in the Journal of Neuroscience found that side sleeping, compared to back or stomach sleeping, enhanced the clearance of metabolic waste products from the brain by up to 25%. While both left and right side sleeping supported this process, left-side sleeping offered the additional benefits for digestive and lymphatic health we've already discussed. Now, if you've been sleeping in a different position for decades, you might wonder if it's possible to successfully change your sleep habits. The good news is that with some simple techniques and a bit of persistence, most people can adapt to left-side sleeping relatively quickly. Here are several practical approaches that have helped my patients make this transition. Start by using a body pillow that runs along your entire left side, from head to knees. This provides continuous support and helps prevent unconscious rolling during the night. Many of my patients find that a C-shaped pregnancy pillow works well for this purpose. Even years after pregnancy is a consideration. Place a regular pillow behind your back for additional support, and to create a gentle barrier that discourages rolling onto your back. Some people find that a wedge-shaped pillow provides ideal support for this purpose. Consider using a pillow between your knees to align your hips properly and reduce strain on your lower back. This makes the position more comfortable and sustainable throughout the night. If you have shoulder sensitivity, which is common in older women, Use a softer pillow under your head and neck that allows your left shoulder to sink in slightly, reducing pressure points. Set a conscious intention to start the night on your left side. While you can't control movement during deep sleep, how you position yourself at the beginning of the night often influences your predominant sleeping position. Patricia, a 69-year-old patient who had been a lifelong back sleeper, successfully transitioned to left-side sleeping using these techniques. "The body pillow was the game changer for me," she shared. "After about 2 weeks, I found myself naturally preferring the left side, and the digestive benefits were noticeable enough to motivate me to continue." It's worth noting that while left-side sleeping offers many benefits, there are some situations where it might not be appropriate. If you have certain cardiac conditions, significant left shoulder problems, or have been specifically advised to sleep in another position by your healthcare provider, it's important to follow that personalized guidance. As with any health practice, consistency yields the best results. Many of my patients report that it takes about 2 to 3 weeks of conscious effort before left-side sleeping begins to feel natural, and about 4 to 6 weeks before they start noticing significant improvements in digestive comfort and hormone-related symptoms. Jean, a 65-year-old who had struggled with persistent bloating and night sweats for years after menopause, noticed gradual but meaningful improvements after adopting left-side sleeping. "The changes weren't overnight, but they were undeniable," she told me. "After about a month, I realized I was no longer waking up with a bloated stomach every morning. And by 6 weeks, the night sweats that had disturbed my sleep for years had reduced to maybe once a week instead of nightly." For women who find it difficult to maintain the left side position all night, even spending part of the night in this position appears to offer benefits. If you naturally shift positions during sleep, don't be discouraged. Starting the night on your left side and returning to it whenever you wake up naturally can still provide significant support to your digestive and lymphatic systems. Some of my patients have found it helpful to use gentle reminders, such as placing a small piece of tape on their right shoulder before bed. If they roll onto their right side during the night and the tape contacts the mattress, the unusual sensation often prompts them to shift back to the left side without fully waking. It's also worth considering the quality of your mattress when making this transition. A mattress that's too firm may create uncomfortable pressure points when side sleeping, while one that's too soft won't provide adequate support. Many women find that medium-firm mattresses with some give for the shoulders and hips work best for side sleeping. Now, you might be wondering why this simple intervention isn't more widely recommended by healthcare providers. The answer speaks to a broader issue in conventional medicine: the tendency to focus on pharmaceutical interventions rather than lifestyle and positional approaches that might address the same issues with fewer side effects. Dr. Michael Breus, a clinical psychologist specializing in sleep medicine, puts it this way: sleep position is rarely discussed in medical settings, yet it can have profound effects on various bodily systems. It's a simple, no-cost intervention that deserves more attention, particularly for post-menopausal women dealing with persistent digestive and hormonal issues. This isn't to suggest that sleep position is a panacea, or that it should replace appropriate medical care. Rather, it represents one of many supportive practices that can complement conventional approaches to postmenopausal health challenges. Beyond the physiological benefits we've discussed, many women report psychological benefits from this intentional approach to sleep. The act of consciously positioning your body for optimal health before sleep creates a moment of mindfulness and self-care at the end of the day. It's a simple but powerful reminder that you're actively participating in your health rather than passively accepting discomfort. For many postmenopausal women, this sense of agency is particularly important. After navigating the often unpredictable and sometimes challenging transition of menopause, establishing practices that support ongoing health and comfort can be empowering. Catherine, a 73-year-old who adopted left-side sleeping as part of a broader approach to managing postmenopausal symptoms, described it this way: "It's such a simple thing, but it represents something important to me. The understanding that I can continue to discover new ways to support my health even at this stage of life. Every night when I consciously position myself on my left side, I'm reminded that I'm not passive in my aging process." So let's recap what we've learned about left-side sleeping for postmenopausal women. This position may support optimal digestive function by working with your anatomical structure, potentially reducing issues like reflux, bloating, and constipation that often increase after menopause. It appears to enhance lymphatic drainage, which may improve the clearance of hormone metabolites and reduce persistent hormone-related symptoms. It may support cardiovascular health by reducing pressure on the vena cava and improving overall circulation, particularly important as estrogen's protective effects diminish. It could enhance lymphatic clearance in the brain, potentially supporting cognitive function and mood stability. With supportive pillows and consistent practice, most women can successfully adapt to this sleep position within a few weeks. The benefits typically begin to appear within 4 to 6 weeks of consistent practice, though individual experiences vary. As with any health practice, it's important to listen to your body and consult with your healthcare provider, particularly if you have specific medical conditions that might affect what sleep position is best for you. This information is meant to complement, not replace, personalized medical advice. If you've been struggling with persistent digestive issues, hormone-related symptoms, or sleep disturbances after menopause, left-side sleeping represents a simple, no-cost intervention that might provide meaningful relief. Combined with other supportive practices like appropriate nutrition, regular movement, and stress management, it can be part of a comprehensive approach to thriving in your postmenopausal years. Remember, menopause isn't the end of your wellness journey. In many ways, it's a new beginning. Simple practices like optimizing your sleep position can help ensure that this new chapter includes greater comfort, vitality, and hormonal balance. If this information has been valuable to you, please consider sharing this video with other women who might benefit. So many women unnecessarily accept digestive discomfort and hormonal symptoms as inevitable aspects of aging, unaware that simple adjustments like sleep position might offer relief. Subscribe to our channel for more evidence-based natural approaches to women's health after menopause, and tap the notification bell so you never miss an upload. Each week we explore different aspects of postmenopausal wellness, always focused on practical, effective approaches backed by both traditional wisdom and modern understanding. And please, leave a comment below sharing your own experience with sleep position or any questions you might have. I read every comment and do my best to respond to as many as possible. Your feedback helps guide the topics we cover in future videos. Thank you for joining me today. I'm Dr. Rachel Thompson, wishing you restful sleep and vibrant health in all your postmenopausal years. Until next time, take good care of yourself.